Thank you, Anna. Hi, everybody. Good to see familiar faces. So we have 4 of us today. We're going to be going through the content and talking a bit about evaluating MDTs. We're going to start out with some content by Julia, Rowan, and myself at USC, and then we'll pass it over to our close colleagues and wonderful friends, David Burns and Tony Rosen, from the wrong coast of the US, but never mind. So I'll start with some general introductory content and then turn it over to Julia for a little bit more in depth before we pass the torch. So first and foremost, we wanted to go over a bit the general concept, the general idea and approach to evaluating MDTs. This is something that everyone who's here and who's watching this is generally familiar with. Maybe you've heard about it, maybe you've been exposed to some evaluations, but I think the term evaluation and the idea of evaluation can sometimes be very lofty, very unattainable, something that you don't really know what it is. So hopefully we'll provide a little bit of clarity during this webinar as to that, and then provide some more tangible approaches and other considerations as you think about evaluating your own MDTs. So first and foremost, why would we want to do something like this? Why would we want to evaluate our MDT? Our MDT works really well. We know it works well. People keep coming, we get cases, it's great. Well, that's fantastic. And that's a great kind of internal, more subjective measure of success. The fact that people are engaged, the fact that people are liking it, cases are coming in, etc. But how do we really, how can we really turn that into something that could be reported to outside parties? How can we turn that into consistent metrics, consistent numbers, or even concepts for dissemination to other people to help share with them what you know to be true, that your MDT is wonderful, is great. Or perhaps how do we share with others and help ourselves to understand better the ways in which it might be good or okay, or sometimes not so good, and the ways in which the MDT could grow and could really work to develop itself in the long run. So doing evaluations, coming up with these metrics, coming up with these systematic approaches to reporting on the on what your MDT does can be really beneficial for reporting to stakeholders, reporting to funders, whether that be granting agencies, grant-making agencies, foundations, perhaps your local city, county, tribal government that's providing funding for the system, for the ongoing function of the MDT. They tend to like to have some information about how the team's doing, and evaluation is exactly how we get there. For the purposes of sustainability, perhaps for finding future funding, showing value to potential future stakeholders so that they can really see the benefit and the value added and the good work that's being done within your MDT. It's helpful for organizational change, as I mentioned before, both internally to adapt your MDT and customize it so that it really functions in the best way possible, but also thinking externally about how your MDT can be tweaked, or how you can really adjust your practices with regards to the broader organizational environment in which you operate to ensure that the process and function of the MDT and the MDT's liaising with the external community is as seamless and effective as possible. Quality improvement or process improvement is crucial. Having evaluation data is really central to that, as I said before, to improving ourselves and to making sure that we're operating as efficiently as possible. And then also for replication and model fidelity. Hopefully you all are developing or working in MDTs that you believe in, that you trust, and that you think would work and be effective elsewhere in other contexts and environments. It's really hard to tell people how to do things and how to replicate what you're doing unless you have a pretty systematic understanding of what's going on within your MDT, which provides you a way to convey to others what you're doing in a way that they can take it on and replicate it. So all these things are the general reasons why evaluation can be helpful, beyond just really knowing that what you're doing is good, is helping people. There are several different ways that we can approach evaluation, several different methods that we can use. But most importantly, I think for this discussion and for us to focus on today, multiple different targets, multiple different things that we can really focus our evaluation efforts on. So in our conceptualization, in our thinking about evaluation, we tend to think of it in a few different buckets. So you can evaluate the structure of your team and the broader organization, kind of what pieces are where, the process of your team, how everything functions, how it all works together, the client level outputs. So that's really kind of the things that are specific to clients that are achieved during meetings, really the tangible things that are delivered by the MDT. That can be things like sending clients out for referral to prosecution, conservatorship, other services that might be provided as a result of the MDT's convening and the case being presented there. Client level outcomes, which is taking that a step further and really saying how does the client benefit? How is the client's life going to improve in the long run? Hopefully improve, perhaps through higher levels of safety, heightened well-being, etc. And then system level outcomes. How does the MDT's operation really impact the broader system within which it's situated? Things like organizational efficiency, things like different agencies within the county, the tribe, what have you, being able to work together more efficiently, more smoothly. So Julie and I will talk a bit about the structure and process and the system level outcomes, and then David and Tony will talk a bit more about the client level metrics, the client level perspective, and the client level approach to evaluation. Hopefully that's in line with what you will do. Anyhow, we'll see. So let me start out by going into the structure evaluation a bit. Structure evaluation, as I said, is really getting an idea of what the pieces are, what's involved with the team, what's coming to the table, what organizations there are, the structure in which they operate, the tangible things like infrastructure, meeting space, what have you. Really gaining an understanding of what there is, what it is that constitutes your team. Again, especially thinking towards replication. This is really important for other people to see what you had to bring together in order to make the team function. So before you can press go, what infrastructure, what pieces need to be in place, need to be established as a foundation for all the other good work to be based on. A really helpful way that we tend to use to put together the structure of a team, as well as a bunch of other pieces, is a logic model. Many of you perhaps have heard about or used logic models in your work. Logic models are pretty universal. They can be applied to a huge range of organizational, operational, project contexts. And they're very helpful for really thinking through the different components, the different pieces, and the flow of an organization, of workflow, etc. Julia, I think you have an example of a logic model that we'll put up. I'll give her a couple minutes to get that up there. Oh, perfect. Thank you very much. So this is a worksheet from the CDC about the different components of a logic model. We'll also paste the link into, oh, she pasted it into the chat already. You're on top of it. This is something that you can keep as a tool for yourself as you think about using logic models and applying them to your own context. These are the most common components of a logic model that we need to gather up, put together to help organize, again, the different components of an organization, of an MDT, help us understand what's the table with regards to the inputs. So the inputs are the resources. What we're doing once the team comes together. So that's the activities. That's really all the functions of the MDT. And then the outputs, the things that are really generated, the kind of metrics sometimes, the products of the activities, as it says here. Then we move on as we think through the logic model to what that's expected to lead to. So we have the inputs, the activities, and the outputs. Those lead then into the outcomes, some of which we talked about before. These can be short-term outcomes, intermediate outcomes, long-term outcomes. Logic models are pretty flexible. You can customize the logic model to meet your needs. Many logic models, traditional logic models, certainly separated out outcomes into short-term, intermediate, long-term. I oftentimes see logic models where they'll just have one big outcomes column. You can really make it work however it makes sense to you. Dividing it into short-term, intermediate, and long-term can be really beneficial because it helps to delineate for you what are the immediate outcomes that are expected to come from your MDT activities. What are the specific effects that are expected to come as a direct result in the near term. And I think it really helps you to target your activities and target your outputs to ensure that you are aiming for those near-term outcomes, and then think through kind of the process of how those near-term outcomes can evolve into intermediate and long-term outcomes, again, with the overall goal of pursuing the broader mission, the broader purpose of your MDT. I'll also say that this whole process, the logic model and evaluation in general, is really inherently linked very closely to the strategic planning process that can be taken on by organizations. Perhaps, hopefully, some of your organizations have taken on that task, come up with a mission, a purpose, etc. Having those key principles, those key foundations in mind as you're putting together a logic model can be very helpful. And ensuring that they're all really operating in conjunction with each other is fantastic, is immensely beneficial to demonstrating that the structure, the activities, the process that you have in place is in line with the purpose, the mission, the goals of your team. And Julia's just put up an example of what a logic model can look like. So we have on the left here resources, those flow into activities. This logic model, as I said, they're flexible. It includes a column of who we reach and then outcomes. This doesn't have a specific place where it specifies outputs. And not sometimes, quite often you'll hear argument, discussion, contention over what is an output, what is an outcome. As people think about and put together logic models, there's some infighting, some arguments. That's a good thing. It's a process. These logic models are living documents. They can evolve over time. They really should reflect how things work, how things operate within an MDT. And they can be a great way to convey to outside audiences what the structure is and what the process is of the MDT as we go from resources to outcomes. The logic model that Julia is showing now is actually from a paper that was done just over a decade ago, focusing on the Los Angeles County Elder Abuse Forensic Center, which is an elder abuse MDT that Julia and myself have worked on for a long time. This was a paper that took a few different approaches to evaluating the structure and the process of that MDT. So the logic model was undertaken to really get a handle on the structure. And this paper, the broader research project, took a few different approaches to really drill into the process of the MDT. So this paper used a couple different tools to understand some key components of process that we think are important for MDTs, for how MDTs work. A few really crucial things that I'm sure are on all of your minds already are frequency of team meetings, team member attendance, the engagement level of the team members around the table. Some of these things are covered in this article, and we'd be happy to share this article with anyone interested after the webinar. This article also brings into practice a modified version of a longstanding tool in the organizational management field. It's called the Team Effectiveness Inventory. That's an inventory, a tool used to really gauge how well a team's operating, how well the members of a team think that the team is working in terms of its function, in terms of how various things are going. The teaminess, basically how the team functions as a cohesive whole, and a whole bunch of different things. So again, if anyone's interested, we'd be happy to send this around for your perusal, and you are welcome, of course, to implement it in your own MDTs to get a sense of where you score on the team effectiveness inventory. It can be a great way to, well, probably not to compare your MDT to other MDTs, but really to look at your own MDT to gauge how you're doing over time. If you're seeing low results on the team effectiveness inventory, perhaps aiming to improve those over time. As I'm talking, I'm realizing I have taken up way more time than I was intended to. So I think I better stop there and turn it over to Julia to talk about the other components of process evaluation and take us into system level outcomes.
Thank you, Zach. Does anyone have any questions at this point? Okay, really good. So let me see. One other way you can evaluate your teams is to look at the team process, and that would in some ways be expanding on that activities box in the logic model to find out what are the workflows, what do they look like? And I'm going to show you an example of one that we did on the same team. This was really a fun project, actually. What we were talking about was a case discussion in an MDT, and there's just this assumption that, okay, we all show up, cases are brought, they're discussed, and then good stuff happens as a result of that. But we wanted to look a lot closer at what type of information is most crucial, what types of questions are people answering, and the objective of this was to help inform folks before even bringing their cases to the meetings on what types of information would be most conducive to a fruitful case discussion. So this is the result of some surveys that we administered to the team, and also there were a few case studies, some sample cases that we asked them to explicate what types of questions they would ask. What you're looking at is a process map. It's basically another visual depiction so that you can delineate what goes into the discussion, what happens during the discussion, which is the case analysis, and then the decisions that are typically made in an elder abuse case discussion. Okay, and this one we can also send to you. So this is really useful if you're wanting to engage in process improvement or even program replication. And then another way to evaluate MDTs is to look at what are the system level outcomes. So Zach had mentioned to you the evaluation that we had done nationwide with MDTs. And in addition to the reason you all come together is to help improve the lives and the safety of the people whose cases you review. There are other benefits to the systems whose representatives come to the table, to the meetings. And what we found was when we asked folks, just a very simple question, what are the benefits of your MDT? They of course, they spoke about improving the safety and reducing risk in the clients, but they also said it's a really great place to learn. It's not just learning about what other systems do, but learning how to be more effective in their own jobs, both working directly on the cases, but also when you go back to your own work and working on cases that don't even ever come to the MDT, people reported that they're able to think about their cases better, they're able to be more efficient, they're able to be more resourceful in their organization. So those are just some things to think about when you're wanting to quantify the value of your team, not just what it does for the people you serve, but what it does for the organizations who invest their time and their personnel and maybe their dollars to sustain and keep the team running. Some other benefits might be kind of touched on organizational efficiency. Not only are the individuals from the organizations more efficient, but it could help bring ideas that could make help these organizations to talk better to one another, to reduce silos, and also to reduce burden on frontline staff. If people who bring their cases to the team feel supported both in the activities that they do and also emotionally supported, there's some ideas around that, reducing burnout and helping to make them better at what they do and happier in their work. Some of these things are trickier to measure than others. You can do that using a simple survey, and that's something that we're happy to do. If you're interested in exploring how to adapt any of these things to your own MDT, you can contact the center and let us know how we can help you. And with that, I'm going to turn the mic over to David and Tony.
There was one question that came through in the chat about how you get that information. So is that type of information gleaned primarily through surveys? And if so, how often do you survey your MDT members?
That's a great question. You can do it a few different ways. A survey is a great way to go if you already know more or less what you want to measure and you want to get responses from people that is just purely out of their own brains. But another good way to do it is at a meeting to have a case discussion. I mean, not a case discussion, but a discussion with the team. Essentially a focus group where you're wanting to understand how they are thinking about things as a group. And that's something you can do before you develop a survey. It's a good way, or even in lieu of a survey, to understand things like process. How does the process flow? And what types of concepts are most important to measure? Zach, do you have anything to add to that? Oh, you asked how often? And how often I think would depend on what it is you're trying to achieve. So if you're wanting to measure change, then you would think about the period where you might expect to see change and use that as your time point for measurement. But if it's something you just want to gather information at one time, it all depends on what your goals are. Zach, do you have anything to add, or?
Just on the frequency, a lot of that I think is related to how often your team meets, because it's hard to, I think, change of team culture, change of team operations is in many ways more related to the amount of time the team spends together versus just the amount of chronological time. So for teams that meet weekly, they might expect changes on a much faster time frame than teams that meet once a month or once a quarter. So for the Los Angeles team, for example, we did those team effectiveness surveys on, I believe, a quarterly basis because the team meets weekly. And so we were really interested in change over those periods. But for teams that meet less frequently, that just wouldn't really make sense, and you wouldn't expect to see change over that kind of a time frame.
Julia, I was really intrigued to hear you talk about the support that individuals feel based on being part of a team and not feeling so alone in their work. And do you have an article around that? Because I think that's something that even is happening more during the pandemic. That would be a big sell for folks who are feeling agencies' reluctance to spend time in another meeting.
I think a good source for that, and Zach, correct me if I'm wrong, but we had both a report and and an executive summary of the national research project that touched on some of those points. Does that sound right to you, Zach, or is there anything else?
No, I think that would probably be the only published source right now, at least from our work. And I don't think there are other published reports of that kind of an effect that are elsewhere. If we're wrong and someone knows of some, please do let us know. But off the top of my head, I can't think of others. And Lisa, you're actually making me realize we have not yet disseminated our final report from that project. So we'll need to send that around on some listservs, and I will post a link to it in the chat right now.
Excellent, thank you.
And again, all of these things are very individualized to the team and to what your goals of the evaluation are. So if any of you are interested in thinking around this together, we're happy to spend some time with you one-on-one, helping to give some advice or look at something you already have and make it a little better.
So thanks, guys. I'm happy to take over and sort of start our second section, David Burns and myself. And a lot of what I'm going to discuss is really led by David. But hopefully we can together give you a little bit of a framework specifically for client level outcomes. And if you think about it, what we've discussed are process and system outcomes, both of which are very, very important and hopefully very, very compelling. But ultimately, team members, team funders, other agencies, and frankly, even your spouse or someone that you might meet and explain to them what you do, those folks are going to say, well, gee, does it help people? And so fundamentally, client level outcomes are an important part of the story. It turns out they're also not a very easy part of the story for a host of reasons, and I'll sort of lay out a bit of the beginning of that, and David can take it on as well. But ultimately, we're talking about clients, some of whom we don't even know their names, and we don't know much about them necessarily. But if we want to talk first about client level outcomes, the first piece was mentioned by Zach and Julia. Obviously, we can measure things that we do for clients. So we can measure services provided. We assisted the client in changing the locks. We made a referral to this agency. Those are, again, process rather than outcome related, but they are certainly things that the MDT has done. You can imagine a list of things that an MDT does for an individual patient, or you can imagine the number of times that an MDT offers a specific intervention from a list of interventions to the clients that are discussed in meetings. And so that's the first, and no big surprise, the easiest thing to measure. But then we talk more about outcomes. And we worry, of course, and I'll mention this only briefly, we worry that any intervention in this very, very complex phenomenon might have bad as well as good impact, might have harm-related impact for the client as well as help, or may not have the intended impact for the client. And ultimately, there are a lot of things that you can measure. Again, in medical world, we measure things like mortality, institutionalization, and other sort of longer term outcomes. But if we have to think about one outcome for MDT clients, in other words, what is the goal of the MDT and the MDT process from the client perspective, it's probably, or rather, David and I and others in the field think that it is reduction in risk of re-victimization. And I'm going to talk about that for a little bit, because I think that's a concept that at least we think is an important one. First, reduction. We don't think it can go to zero, and in many cases, we don't think it should go to zero. That's not necessarily what a client wants. But we recognize that reduction in risk is important. And we'll talk in a second about risk of re-victimization. So this isn't in a population of older adults who might be victimized. We presume that MDTs are meeting about clients who are already victims of some type of mistreatment. And so the way we're framing this outcome is, how do we reduce, not eliminate, but how do we reduce the risk of re-victimization? And how do we assess whether that's happened? Now, I'm going to talk about the assessment in a second, but before I do, let's sort of play out for a little bit the value of this kind of analysis. Hey, we had 12 patients, or 12 clients rather. I'm an ER doctor, I apologize. We have 12 clients that we saw over the last year, and at intake, their risk of re-victimization was X. And after we talked about them over the course of 2 meetings over a year, their risk of re-victimization was Y, and Y is smaller than X. And so you can imagine that by quantifying risk of re-victimization, you might be able to describe how your MDT process is contributing to improving this very important outcome. In addition, by quantifying risk of re-victimization, you can, at least in theory, compare multiple different cases that you see at the MDT and say, well, this one's at a lot higher risk, so we should bring this one back faster, or we should do these other steps for this case because we think this client is at higher risk now. So you can also compare your MDT to other folks on the phone. Again, if we had a standard measurement of risk of re-victimization, then we could compare the cases that the Los Angeles Forensic Center sees to the cases that one of the tribal MDTs sees, to see whether they are higher risk or lower risk, and in what categories. And David's going to talk quite a bit more about that. But I'm just trying to sort of frame these questions. And so, again, the expert in this area is David, and you're going to hear from him in a few minutes. But one thing that was informally done by MDTs in New York that were thinking about this very question was, at the end of the meeting, they had a poll. What do you think the risk of re-victimization for this client is now that we've had this meeting? And they did that for every client and on multiple meetings. Now, again, it was just a single question. And so it was relying on the individual members of the MDT, who obviously perhaps have different perspectives on things. And it was relying on the information that was available. Risk may go up because you find out more information, not because circumstances change. But you can hear, the reason I wanted to bring that up is as a way for you to think about how this might already have been operationalized for individual MDTs. You can just say, hey, what's the level of risk of re-victimization for this older adult? And so ultimately, from my perspective, and then I'm going to hand it over to David from a time perspective, but from my perspective, I think that we all believe that this is the direction that the field is going and likely needs to go, which is to do its best to describe the impact of MDTs and, by the way, other interventions. These kind of questions are just as appropriate for client interactive intervention, like, for example, adult protective services and other interventions, but the same set of client-level outcomes, client-level impact is likely a direction that we want to be moving as a field to continue to describe both a lot of things. The first is the impact of our work on vulnerable older adults, the comparability of our work to that of our peers, and the case mix that we're seeing in our environment and in our MDTs. And so these, again, what I'm talking now about is a bit of a further future, for which I apologize. But I don't know that it's as far away as we think. And I think that there are, as I mentioned already, and as David's going to describe in more detail, some steps that individual MDTs can take now to start to think about how are we answering that question, that fundamental and simple question, which is, well, how is this helping and not hurting the clients that we serve? So David, is that a fair introduction to send off to you? It looks like Lisa has a question. So
Well,
I'm going to respond to your question, Lisa, and then David,
Okay.
I'll hand off to
So Linda Laughlin-Pettit out of Denver asked a question around the New York poll that was done in terms of, did the poll reflect the risk assumed after the action plan from the meeting was to be put in place, or was the assessment of risk based on if there was no MDT action taken?
It's a good question. David, do you want to respond to that? Because this is your area.
Sure. Yeah, sure.
And it will be an opportunity for you to take the baton.
Yeah. So I think in that situation, we had these anonymous cards, okay, that we gave. The key here is to do this both at the beginning of your MDT intervention for a given client and at the end when you're closing the case. And that's sort of a theme throughout here, is to have a pre and a post, right? And so what we did is at the beginning of when a case was first introduced and you had your first big discussion about the case as a group, we handed out these anonymous cards to all the people sitting around the table and said something to the effect of like, what do you think is the level of risk of re-victimization, high, medium, or low, something like that. And then what are the reasons for your kind of appraisal? So they did that after the first meeting, and then they did that again after the last meeting for a given case. And so what that allowed us to do was to see like kind of the trajectory of the case, right, as it relates to that, as Tony said, sort of central outcome of re-victimization risk. That's a fairly simple thing to implement into your MDT. It doesn't take very long, and it provides you with an important metric, I guess, that you can start to measure right away. The R2F2, or the re-victimization status scale, gets at the same outcome or metric, which is the re-victimization risk that Tony has described, but it's more comprehensive. And so it's a scale with many items, and the items are divided into risk indicators of risk that are attached to the victim, the perpetrator, their relationship, the home environment, and other kind of surrounding contextual domains. And the idea there is that it's actually providing you with a sort of a tangible score, not just an overall score, but scores for those different subscales. And it can actually be used not just as sort of like an outcome measurement tool. Again, you'd want to do this both pre and post, right? At the beginning of your MDT for a case and at the end when you close the case. But we've actually found, based on feedback, that it can be used to help guide clinical decisions for the MDT. So for example, if you're filling this out at the beginning and you see that there's a high level of risk, for example, around social support or social isolation at the level of the victim, that gives you a sense as a team as to like, okay, there's an area that needs attention in terms of reducing the risk of re-victimization. So that, I think what we've been talking about so far is sort of one sort of level of evaluating your MDT, which is sort of like a pre-post design where you're just sort of over time with your single group, your MDT. And I'm going to throw some other designs out there for you because I think it's important to be sort of aware of, and you may already be aware of, but but I will say, I mean, this is tricky stuff. It can be messy, especially with MDTs. But ideally, what you would want to do is to have a comparison group, right? So you're comparing your intervention, your MDT intervention, to some other group, some other control group, to see if what you're doing as it relates to client level outcomes is better than the control group. And so there's a few ways like I sort of thought about that you may be able to do this. Again, I think it's tricky with MDTs. In some MDTs, you've got this phase at the beginning, at least in New York, where they do sort of a consultation, right? So an APS caseworker brings a case to the MDT coordinator, for example, and they have a sort of a consultation as to whether or not this case would be appropriate to move on to the full MDT intervention, right? So one way to construct a control group would be that those cases that were referred to the MDT, but through consultation didn't make it to the MDT, right? That could be your control group versus the cases that did go through the MDT. Okay? Another would be, and by the way, these designs do kind of rely on a partnership with your referring agency, for example, APS, to help you kind of collect data along the way. The other would be to compare, let's say APS is your main kind of referral partner. You would compare cases that are that they send to the MDT, right, to those that aren't sent to the MDT. Now, again, there's some questions that can come up. I mean, are there fundamental differences between those? Are the ones that are sent to MDT, do they tend to be more complex or perhaps more high risk or something like that? And that's something that will need to be discussed. And then you can either, within that design, you can collect data as you move forward with the case, or what we would call a prospective design. Again, you would want to collect client level outcomes at the beginning of your time with the client and at the end. The other way to do it, which is, Zach and Julia's group have published on this type of work in the past, is if it's not possible to kind of collect data as you're following the case along in time, you could, for example, say, okay, over the past year, our MDT has received 50 cases from APS. They also have 50 cases that weren't referred to APS. We're going to look backwards in time now, based on our case records or case management systems and whatnot, to try to compare what happened, between these two groups. The other kind of strategy you could use would be within the cases that you receive as an MDT, you might try, and again, this is trying to understand sort of, we'll often refer to it as kind of looking in the black box. So like if you're trying to understand like what, as an MDT here, what is it that we are doing, right, that works well or doesn't work well? And so one way to try to figure that out would be to do one thing differently with one group of cases versus another group of cases. So maybe it's the way that so with half the cases that you see and that you discuss, maybe you discuss cases in a different way, or you have some different type of processes with MDT versus what you would do with another set of cases. And then you're comparing, and then essentially you're creating a comparison group within the cases that you see as an MDT. Other things that you can do that may be helpful, I've been sort of describing so far, kind of more quantitative ways of doing this type of research, but certainly there's opportunities to do some qualitative research too, some systematic qualitative, for example, interviews with referring caseworkers that are referring cases to you about, what this partnership is like for them and for you, and, or interviewing members of your MDT and trying to get at, again, like what's working, what's not working. Yeah, I mean, I think that's some of the stuff that I wanted to cover. Happy to take any questions.
So Benita from our tribal communities had a question around having a fatality or an acute emergent call after a E-MDT session, and does the E-MDT keep a record of the poll, and can that be legally binding? I guess the question is if there's liability around that traumatic event that happens after an MDT. And Benita, if I'm not reading that right, go ahead and jump in ask it differently.
Okay, yeah, I guess the way I worded it, I just kind of wanted to know if there is liability, or if you have ever come across that, or if the MDT, the E-MDT had adopted this into their practice for their, after their meetings, after, you know, the poll afterwards. Would that be something that could come back and be a liability for them in the event that maybe the score had been lower, and after the score was lower, or depending on the score, and there was a fatality or an acute or emergent call? And I don't know how else to put it, but is there a record of that poll? In your experience, do they keep a record of that poll? And have you ever come across that situation? Would it come back to the MDT and say, hey, we scored that kind of low, or we scored that really high, and this is what happened? Has that ever occurred? Hopefully not, but.
Yeah. So I'm not aware of that occurring, but I think it's a really good question, and actually, not in relation to those cards I was describing, but in relation to some other work that we did in New York. Some of those concerns did come up by the lawyer on the team. In other words, if we're assigning some, adjudication of risk, and this case, comes forward, or something happens, as you say, is that something that can either interfere with our processes as prosecutors, or what you're saying, perhaps liability. Usually there's ways you can work around that. That might be one reason to, maybe partner with an academic institution to do this kind of thing, is so that, they would be collecting data sort of as third-party researchers, as opposed to you integrating it as a part of your record. But I think it's a really good question, but I also think it's something that can be worked around.
Yeah, just to echo what David said at the end there, I think that is in many ways the power and the benefit of partnering with other organizations to do some of this evaluation work, especially if it's an academic institution. Academic institutions are able to apply for basically confidentiality protections for the data that they collect in the course of a research study that would keep it safe from disclosure, even through a subpoena process. So that would help put in place something of a safeguard against the eventuality that you were concerned about, Bonita. We know that MDT's records have been subpoenaed in the past. For MDTs to keep minute meetings, that can be something of a challenge. I don't know if there's too much in the R2S2 that would go beyond what might come out of a meeting minutes. But in terms of liability, I think in order for liability to be established, there would have to be a direct connection between the MDT's activities, actions, or lack thereof to any outcomes that occurred, which I feel a bit out of place saying this to the lawyer on the line, but it seems that might be a tenuous connection to make, and I don't know to what degree the R2S2 data in and of itself would really strengthen that case or open up the team to an immense amount of additional liability. But again, to safeguard against that, partnering with academic institutions, especially if they're able to obtain a certificate of confidentiality, would be a great way to go.
This is Tony. I agree. I think that in some ways, liability is an important concern around all of the work that MDTs do and that individuals that serve clients directly do. I would tend to agree with Zach that it likely, although I am not an attorney, that it likely doesn't sort of incrementally increase liability a great deal. However, that's not an expert opinion, and things that you can do from a confidentiality perspective and from a partnership with an academic institution perspective, and frankly, with the opinion of a lawyer, if there's a lawyer on your team, to make sure that you're thinking about these things. I think they're great questions. I think it's important to evaluate client outcomes, but with evaluating client outcomes goes these additional questions.
Thank you. I just wanted to have that question put out there because of the fatality review teams that come into place when there is a fatality. So yeah, I went to that training down in Columbia, South Carolina on fatality review teams. So I just wanted to ask that question, and thank you for answering.
So we've got a few minutes left on our hour. What other questions that y'all might have? The folks have hit on some real interesting things for us. What other questions do they have? All right, well, seeing none, I'm going to open it back up for any last minute thoughts for our panelists. If you've got any words of wisdom you'd like to share with us before we sign off today.
I would just say, not words of wisdom, definitely, but just echo something that Julia said earlier. A lot of the questions that you might have may feel too individual to share or bring up during this webinar, but you're always welcome to reach out to the team at the National Center with evaluation questions, and they will loop us in as appropriate, so we can really help you to ensure that you have a good plan in place, and that you really have the tools that you need to do a meaningful, comprehensive evaluation that will benefit both yourself in terms of all the things I said before, sustainability, reporting, team growth, but also will benefit the field, because we all and other MDTs can only grow through each of you doing this well. So please do reach out to the National Center so we can help you with that.
And
And
just
this is
so,
Tony.
well, go ahead, Tony.
Oh, I just wanted to add one thing, and I think Julia does. Julia, would you like to go first? Go for it. All I was going to say is that I would encourage you, and I suspect you already are doing it, but I would encourage you to evaluate your programs. Many of us also work in or lead programs, and there is a great deal of value in evaluating a program for the program leadership, for the team members, and for the folks that you serve. And so I would encourage you to do it because I think you'll find that it's a valuable exercise.
And I just wanted to say that, again, echoing what Zach said, is don't reinvent the wheel. If you're thinking of doing something, it could be that somebody else has already done something like that. So contact the center. We can help connect you with something you can adapt to your own team.
Well, thank y'all all. I just want to reiterate for the grantees that Zach and Julia are part of our weekly team meetings, and really have a wonderful knowledge of what we're doing and are connected really well. And so they're part of the surveys that y'all are getting around our work as well as yours. And so they're our home team. So, you know, feel free to reach out and we can connect you with them for additional things. And look at Benita, already has gone through Zach's report to see what's on what page. So way to go. So that's all we've got. I'm going to turn it back over to the in-call folks. And Anna or Alicia, do you have anything else to share?
Yeah, we're going to put the evaluation link in the chat box. Please fill that out. Let us know how today went, and also let us know if you have any ideas for future sessions. And we'll be sending out the recording and the referenced materials in an email later on today. So thank you all for joining.
Thank you all.
Thank you so much. And as always, reach out with any questions that you might have for us.
Absolutely. Thanks, everybody.
Thank
Uh,
you.
Thanks to the
everyone.
panelists.